Hello everyone, and welcome to AH214 reimbursement methodologies. This week our chapter readings will be Chapter 9, Reimbursement Methodology. Healthcare costs are growing each year. In 1983, CMS, formerly called Healthcare Financing Administration, recognized this growth and implemented the first prospective payment system to control the cost of hospital inpatient care. The prospective payment system is actually a method of reimbursement based on a predetermined fixed amount. Years later, reimbursement systems were implemented for other alternate care such as the physician office and long-term care. The objectives of creating the prospective payment systems were to make sure that this was fair compensation for services rendered, to make sure that the process for payment rates would also include new technology and cost of providing care, quality control for hospital services, and a mechanism to resolve problems with treatment between the hospital and the patient. The prospective payment system can be cost-based or price-based. The prospective cost-based rates are based on reported healthcare costs from which a predetermined per diem, which is a per day rate, is determined. The price-based rates are associated with a particular category of patient care and are established by prior payer provisions of healthcare services for inpatient care. I will touch on a couple of the reimbursement methodologies that you might see today. One is resource-based relative value system, also referred to as RBRVS, or Medicare Physician Fee Schedule. This is a cost-based system. The fee schedules are a fee-for-service reimbursement methodology that includes a list of maximum fees and corresponding procedures which payers use to compensate providers for healthcare services delivered to patients. Another one is the Clinical Laboratory Fee Schedule. It's also a cost-based system. It consists of a data set based on local fee schedules for outpatient clinical diagnostic laboratory services. Another one you might see is a durable medical equipment, prosthetics, orthotics, or supplies fee schedule. It's also cost-based. And the DRG, Diagnosis Related Group. Each diagnosis or discharge is categorized into a diagnosis related group, which is based on the patient's principal and secondary diagnosis as well as surgical and other procedures performed. Each of the DRGs has a payment weight assigned to it based on the average resources used to treat patients in that DRG. So those are just a couple of the types of reimbursement methodologies that you might see. Now, the medical billing and revenue cycle management is simply the process by which a healthcare facility or a provider ensures their financial visibility by increasing revenue, improving cash flow, and enhancing the patient's experience. Some of the steps involved in a revenue cycle will be pre-registering the patient, establishing financial responsibility, checking in patients, reviewing coding compliance, reviewing billing compliance, the patient checkout process, claims transmission, sending it to the payer, monitoring the payer's adjudication, generating patient statements, and payments and follow-up collections. Again, what we've talked about this week has been based on different types of reimbursement methodologies. And have fun this week and let me know if you need anything. Thank you.